Thank you, madam. I think we have one more faculty today, uh, Mr. Lalit, uh, who is our facilitator. He has been
He's
working with,
already joined. Lalit is
yeah,
already there.
yeah. So just
Yeah,
introducing him.
yes.
So
Uh-huh.
he has been working with Pallium India for more than 2 years, and he is experienced in facilitating this RMA status to many palliative care centers, especially in South India. Um, so, with this introduction, I am moving on to my session. Is the screen visible?
Yes,
Yes, doctor.
yes, we can.
Okay. So, as Radha Madam introduced, this is very important for all of you because all of you now know how to manage pain. And you know that in the third step, we have opioids for moderate to severe pain. So which includes morphine, fentanyl, and methadone. And in the second step, for a mild to moderate pain, we have codeine, tapentadol, tramadol, all those medications. So out of this opioids, um, there are certain medications which we can use only if we have something called as recognized medical institution status. So um, so all these the opioid things like how to stock, how to procure, how to dispense, all these are described in NDPS Act, which is Narcotic Drugs and Psychotropic Substances Act. Um, and you can see these are the poppy plants with its flower and its pod. And this is the thing. The pod is the most abundant um, uh, opium alkaloid from which we can produce morphine and other opioids. Uh, but from all part of this plant, opioids or alkaloids are available, opium alkaloids are available, but poppy seed is the most abundant source of uh, opium. Okay. Uh, so all of you might have heard about this. So first of all, I am going to introduce you with certain terms because these are the terms which you will come across when you deal with opioid availability. So first of all, we should understand what is a RMI, that is recognized medical institution. So this is a medical institution which is recognized by the state drug controller, and with this you can purchase, possess, and dispense essential narcotic drugs for medical and scientific purpose. Okay. Uh, So if you possess RMI status with your institution, you can stock all the essential narcotic drugs uh, and you can dispense it to the patients also. So can anybody tell me which are the essential narcotic drugs? Anybody? Okay, I can see there are a few response in the chat. Morphine, yeah, fentanyl, methadone. Okay, uh, so there are six essential narcotic drugs at present, and that includes morphine, methadone, fentanyl, codeine, oxycodone, and hydrocodone. Out of this, the first four, morphine, fentanyl, methadone, codeine are available in India, but hydrocodone and oxycodone are not available. Probably it might be available in the coming years. Okay, so uh, so if you have RMI, you can stop all this medication. So we will later see how you can get RMI status. But now we are going to talk about here it is recognized medical institution. So what is a medical institution as per NDPS Act? So a medical institution is it can be a hospital, a dispensary or clinic or an institution which is which offers service or facilities requiring for diagnosis, treatment, or care of illness, disease, injury, or deformity or abnormality. So anything in which we provide care to the patient can be called as a medical institution. And this might be either um, under the administration of a government system, or it can be under a person or a body of person. So any government institutions, it might be under municipal corporation, municipal council, Silla Parishad, all these clinics which comes under government is a medical institution. Or if you are running a clinic, that can be called as a medical institution. Or if it is managed by a number of people, that is also called as a medical institution. So this is another term which you might come across frequently. Who is a registered medical practitioner? According to NDPS Act, you know that you are a registered medical practitioner, but you are registered with your uh, state uh, state medical council. But according to NDPS Act, who is a registered medical practitioner? It is different from the registration with the state medical council. So according to NDPS Act, a registered medical practitioner or RMP, uh, this person can either be a MBBS doctor who has registered with the Indian Medical Council, or this person can be a dentist who registered under Dentist Act. But uh, that's not the single criteria. This person should also have undergone training in pain relief and palliative care, or this person should have training in opioid substitution therapy. So if this person, so this is the criteria for a doctor to become registered medical practitioner or RMP. So only this person can prescribe essential narcotic drugs. Okay. So only registered medical practitioner can prescribe essential narcotic drugs. So uh, even if you are a specialist or a super specialist, and if you do not have training in pain relief and palliative care, you are not qualified to prescribe essential narcotic drugs as per NDPS Act. So as I told you, these six are the essential narcotic drugs as per the Drug Controller General of India. So the Drug Controller General of India can actually notify new essential narcotic drugs. But as of now, we have the we have these six opioids, which is called as essential narcotic drugs. Morphine, methadone, fentanyl, and codeine. These are the four opioids which are available as of now. And who can possess essential narcotic drugs? Can anybody tell me who all can possess essential narcotic drugs? Would you be able to possess essential narcotic drugs? Anybody? Okay. So we know that patients can use essential narcotic drugs, isn't it? Because it is prescribed by a registered medical practitioner. So patient can possess essential narcotic drugs. Registered medical practitioner can possess essential narcotic drugs. So the registered medical practitioner on an individual capacity can hold essential narcotic drugs. It doesn't require um, the RMI status. So, but if you are holding essential narcotic drugs on an individual capacity, then the amount of essential narcotic drugs you can keep are very small. And then RMP, any person authorized by the state drug controller. So you know that the state drug controller is the authorized person to give you RMI status. So if he provides any person with this order that okay, this person can hold this much amount of END, he can hold. Then recognized medical institution, so which we already talked, that is RMI. RMIs can possess essential narcotic drugs. Then, of course, manufacturer and licensed dealer or chemist. In addition to this, certain educational or scientific institute, which is authorized by the state drug controller, can also hold ENDs. It might be for some education purpose or it might be for some research purpose, but this should be authorized by the state drug controller. Then pilot or captain of aircraft or ship for emergency use. And person in charge of ambulance, again for emergency use. So these are the people who can possess essential narcotic drugs. Suppose you are going to prescribe any of these ENDs, essential narcotic drugs. What are the requirements, or what all should you be careful while you prescribe essential narcotic drugs to a patient? Anybody? Okay. So we should be giving, we should be writing the prescription with the date.
Excuse me, Dr. Sunil. Dr.
Yeah.
Sundaram has just raised his hand. Is it Sangeet? Can you find out just attendance, or does he wants
No,
to
no, no. I
ask?
just wanted to ask a question, madam. Doubt.
Please unmute and ask. That is why I thought
Yeah.
better to go
Yeah,
ahead.
he had said that a medical practitioner, even though he might be a super specialist, cannot prescribe narcotic drugs, essential narcotic drugs. But in the subsequent slides, he has said that a registered medical practitioner can possess narcotic drugs. Isn't
Uh,
it mutually contradictory?
and no. So if you are having RMI status, that is recognized medical institution status. Suppose you are working in an institution or a hospital. Your hospital can have RMI status to possess essential narcotic drugs. And that medication can be prescribed only if there is registered medical practitioner. That is, if the patient, if the doctor with training in pain relief or palliative care or oral substitution therapy. But this is also applicable to the individual practitioner who need to be either trained in pain relief or palliative care or should have experience in oral substitution therapy. So that is not contradictory. I did not mention that. That's all. So that
Sir,
means you need not have a hospital to hold END. That's what you have to understand. If you have a clinic and if you want to hold a few number of essential narcotic drugs, that can be done. But
And
to
Sunil, I
pres
think he is
sir,
asking in the other way. if someone is in a hospital, I think Sundaram, is that right? What he is asking, if there's a big hospital, they have everything. So are they not eligible to prescribe? Is that what you're
For
asking? I
example,
think that.
can I make it more
Go
clear?
ahead.
For
Yes,
Go
yes,
ahead.
example,
please.
in our hospital, the medical oncology department is the one which is dispensing morphine,
Mm.
right? And
Yeah.
to my knowledge, no one there is trained in palliative care.
So
But
that is
everyone, even a surgical oncologist like me, can write morphine, and it is being dispensed. Second is, outside many of the routine general practitioners, they give fentanyl transdermal patch. They also prescribe codeine cough syrup for intractable cough. These are all being dispensed with without any requirement for training in palliative care. That's what I wanted to ask you.
okay. Thank you for that question. So if you look at the NDPS Amendment Act, it clearly says that only if the person has training in pain relief and palliative care, or if the person has experience with oral substitution therapy, then only they can prescribe essential narcotic drugs. And if there might be other practices like without these training, people might be practicing, but that is not legal according to the NDPS Act. So I will be sending this NDPS Act highlighting these points. Okay.
Okay, sir.
So the ENDs, the requirements for prescribing the ENDs, you should sign, you should have your full name, your address, and your registration number with medical council. And there should be the name and address of the patient. And if you are prescribing any END, so you know that it should be in capital letters. This is not according to the NDPS Act, but the NMC or MCI has repeatedly asked doctors to prescribe medication with capital name. So it should be in capital name. You should uh, be giving what is the dose of END you are prescribing. Suppose it is morphine 10 milligram. So you should write morphine 10 milligram. And what is the daily dose? Is it 4 hourly or something like that? And how much are you providing? So if it is for 2 weeks, that is period of consumption. So you are prescribing 10 milligram every 4 hourly for 1 week. So 1 week, you need to give at least 42 tablets. But you also know that you have to give SOS dose. So it might be up to 50 or 60. So you should write the period for which you are prescribing the END along with the quantity. Is it 50 or 60? Okay. So all these should be there in the prescription of an ENT as per NDPS Act. I hope that is clear. So now we'll see what are the prerequisites for a RMI, that is recognized medical institution. What all should be there for you to apply for recognized medical institution? So there should be a doctor who is either having MBBS or BDS and registered with corresponding councils, either in medical council or with the dental council. And the institution should have, I already told you that this person should have training either in pain relief or palliative care, pain relief and palliative care, or in oral substitution therapy. That is what is meant by be trained in the medical use of opioids. And there should be safe storage capacity of ENDs. So a double locking system is what is required. So this is to keep the ENDs safe. under safe custody. And other enough infrastructure so that patient can can come and lie down or sit down, and the medical healthcare workers can examine this patient and administer ENDs if needed. And uh, there should be facilities to maintain the registers and enough human resources for all this purpose. So if you look at this prerequisites, what it actually requires is a doctor who either MBBS or BDS with training in pain relief and palliative care, or the person should have training in oral substitution therapy. Then you should have a safe lock-in capacity for keeping the ENDs safely. Then there should be enough infrastructure and human resources to evaluate the people who are coming and administering medication. Then you should have enough space to keep registers. So if you have these facilities, then you can apply for recognized medical institution status. And some people, there are people who are asking that we have RMI in our institution. Can we use it for home care? Can we use it for IP, inpatient unit? So if an institution hold an RMI, this can be used for all the purpose, including home care treatment. So this is clearly given in the NDPS rules. It says home care treatment is permitted. The only condition is that the patient should be registered with RMI. So we actually dispense ENDs only to those who is registered with us. So they are automatically registered with RMI. And if uh, in an institution, there might be one designated medical officer for the ENDs. So he can actually designate a person to carry ENDs to the patient's home. And END should be given at either at home or at the place of stay where the patient is. Okay, so you have to maintain all the records, which I will come later. So understand that for home care treatments, you need not have a separate recognized medical institution status. If your institution has an RMI, then that can be used for treating patients in outpatient, inpatient, as well as home care. So now we'll be looking into the process of getting RMI. So what should you do to get RMI or recognized medical institution status for your institution or for your hospital? So first of all, you should satisfy the prerequisites, which we already mentioned. Then you should apply for RMI status. Then the state drug controller, he will designate somebody, or he may come himself to inspect your institution. And if he is satisfied, he will authorize your institution as RMI. Once it is authorized, then you can give purchase orders to the place from where you are purchasing. And once they allot these ENDs, it will be along with the consignment note. And then you should keep it in your double locking system, and you can dispense it. Then if whenever you dispense, you have to maintain all the records, and you have to file annual returns, and every 3 years you have to renew your RMI status. So we will go through each step. So the first step is prerequisites, which we already mentioned. Is there a person with training in pain relief and palliative care? Then the next is you should apply RMI status to the state drug controller in the form number 3F. Okay, so I will show you the form number 3F little late. And it should be addressed to the state drug controller by the in charge, whoever is the in charge of the institution. And in that, there is a separate column in which you can mention who all are the doctors uh, who, who has training in pain relief and palliative care and who will be prescribing ENDs. And if there are more than one person who has training in pain relief and palliative care, the institution can designate a person who would be overall in charge of recognized medical institution status. And this application form should include copy of your degree certificate, your registration certificate with the medical council, and your training certificate in pain relief and palliative care. So we have to fill the form number 3F. Then form number 3J, in which you have to give annual estimate. Okay, so when you apply for the first time, uh, I will show you that format. What is the amount of ENDs that you require? So if you are starting for the first time and if you do not have much patience, you can just write 500 grams of morphine. And the others like fentanyl and methadone, codeine, or you can write as per the requirement. And there should be a covering letter why you are applying RMI status. So you can say, okay, we are having this many number of cancer patients and they are having pain, and out of this much patients would require morphine as per evidence, and so that we want to become RMI. So that's the covering letter. And there should also have a self-addressed stamped envelope for worth rupees 27, so that the state drug controller, if they are satisfied with the inspection, they will send you the RMI status in this self-addressed stamped envelope. So you can see this is the form number 3F. Okay, the first one is the form number 3F, in which there is name of head or in charge of the institution. This might be your superintendent or your medical director or somebody. Then you can see under which category are you applying for RMI? Is it for palliative care or is it for oral substitution therapy? Then name or names of qualified medical practitioners who would be in charge of essential narcotic drug. Suppose your institution has 5 or 6 person. You have to write all those 6 person who is qualified to prescribe ENDs. And if there are more than one qualified medical practitioner who is trained in medical use of essential narcotic drugs, indicate the name of medical practitioner who shall be overall in charge. So one person would be the overall in charge of essential narcotic drugs. That should be written there. And along with this form number 3F, you have to also submit form number 3J. So you can see this is the estimate of annual requirement of essential narcotic drugs. So you can see what is the name of essential narcotic drugs which you are going to purchase. What is the quantity dispersed during the previous year? So that would be 0 if you are applying for the first time. And estimated annual requirement, if it is morphine, you would write maybe 500 grams. So likewise, you can write all those essential narcotic drugs that you require. Then once you apply, either the state drug controller or a designated person by the state drug controller will come to inspect your institution. And if he think, okay, you are a person with training in pain relief and palliative care, you have a developing system, there is enough infrastructure, he is satisfied with the requirement for RMI, then he would give you with the RMA status. RMA status is provided in form number 3G. And this is the validity is for 3 years. That means every 3 years you have to renew the status. And once you apply for RMI, the drug controller should give you a reply within 60 days, even if it is positive or negative. Sometimes he may say that, okay, I'm not satisfied with the prerequisites. There is no person who is trained in pain relief and palliative care. There is no safe locking capacity. I'm not satisfied. So he will deny RMI status and will give you a letter indicating that, okay, your request is denied, stating that reason why he has denied it. So this has to be done within 60 days from the state drug controller part. But there is another thing. If you are a government hospital, you need not apply for RMI status. You are deemed to be RMI. Okay. So according to the NDPS Amendment Act, if you are a government medical institution, you need not apply for RMI status. You are deemed to be RMI. But the condition is that there should be at least one trained registered medical practitioner. That is a person who is trained in pain relief and palliative care. So the only thing is that for government institution, you need not apply for RMI status, but otherwise you have to keep all the records. You have to file annual return, annual estimate. All those has to be done. You have to keep all the records. And once you get the RMI status in form number 3G, then you can now fill the form to get essential narcotic drugs from a manufacturer or licensed dealer or chemist. And then they will give these ENDs along with a consignment note, which is in the form number 3C. And there would be 3 consignment notes. One is in the color of this consignment note. One would be white. The other two would be, one would be yellow and the other would be pink. So the original, that is the white, that you will keep with you. And the other two, you will sign it and send it back to the place from where you purchased the ENDs. So this is the format in which you will place order to purchase ENDs. So you can see what is the name and address of your recognized medical institution. Describe the quantity for which order is placed. Description of the quantity. Is your institution recognized by the drug controller? Whether the order is covered by the estimate approved by the drug controller? And what are the details of order of purchase made during the year? If you have made any purchase during this previous order, you should write it in it here. And this is the consignment note you will get from the licensed chemist or dealer. This is form number 3C. You can see what is the name and complete postal address of the consignee. Here it would be your hospital's address. Okay. And what is the description of consignment? What all essential narcotic drugs have you purchased? You can see here morphine 10 milligram, 30,000 tablets. Vermer 10 milligram SR, it's 1,000 numbers. And mode of transport is through speed post. And the who is the consigner, they will sign it, they will seal it. And you can see this is the part which you have to fill, and this is the original which you will keep, and the other pink and yellow you will give it back to the consigner who sent you this ENDs. And if when you dispense ENDs, any ENDs, so we already told we have 4 ENDs in India. So you have to fill this format. So you can see what is the name of the patient, postal address, brief description of the illness, whether this patient has registered with any other medical practitioner or medical institution, what is the details of essential narcotic drugs you have dispensed. You can see here, this patient is given tab morphine 2.5 milligram, Q6H and SOS. And how much quantity was given? 24. And patient need to sign it here, or the thumb impression of the patient should be here. So whenever you dispense essential narcotic drugs to any patient, you have to get this form signed. So for each patient, you have to keep this form number 3E. And in addition, this is the format which recognized medical institution has to be kept in the RMI, recognized medical institution. So which will contain all the purchases that you have done. So you can see this, there is the red letters. You can see who is the manufacturer, which is the date from which you have purchased essential narcotic drugs, what is the quantity, batch number, expiry date, and you can see that is entered on in the stock. 30,000 is entered in the stock. And every day you have to keep the record for which patients you have given or dispensed the ENDs. So you can see on 22 April 24, here there are a few patients for whom the essential narcotic drug has been given. You can see the batch number, what is the quantity disbursed, and what is the closing stock. This has to be done every day. And you can see also see the signature of the person who is the in charge of the RMI, that is recognized, the registered medical practitioner. He need to sign it every day. So this is called as form number 3H. So if you have RMI status, you have to maintain this format 3H, and it is your responsibility that this record is kept up to date with your signature. And you may wonder, how long should I keep all these records? So the records should be kept for at least for 2 years from the entry of last date of last entry. That means suppose you are the last entry is today in a register. So you have to keep it till 2026 August 8. Okay. And we already saw what is form number 3H, in which you can see which all patients we have dispensed ENDs and where all we have purchased ENDs. And form number 3E, from which that is the form in which we have to get the patient signature. And before 31st March of every year, you have to file the annual return in the form number 3I. So suppose it is for 2024, you have to file the annual return before 31st March 2025. So from 1st January 2024 to 31st December 2024, you have to take the account how much essential narcotic drugs you have dispensed, how much you have purchased, what is the stock with you. So all these should be there in the form number 3I. And so this is what RMP, registered medical practitioner on individual capacity, can hold ENTs, but this person should also have training in pain relief and palliative care. So he should, this is this is to use for emergency purpose. This is not to sell for anybody. So this should be given under the direct supervision, under your direct supervision. So you can see the numbers or the quantity of ENDs that you can keep under this option is very small. Morphine in any format should not be more than 500 milligrams. That means if you are keeping 10 milligram tablets, you should not keep more than 50, 50 numbers. And codeine, hydrocodone, fentanyl, oxycodone. So you can see the quantities that can be kept on an individual capacity if you are an RMP is very, very small. But there is also another option. If you need more quantity, you can apply to the drug controller, and sometimes they may permit, they may give you that permission in the form number 3B. So I just want to show you the how essential narcotic drugs is kept in our institution. So you can see this is a room which is locked, and this is a cupboard which has 2 doors. So this is one door and the other one is, and inside this you have to keep the essential narcotic drugs. So if you have RMI and you know that your friend is working in another institution, he is asking you, you have motion with you, isn't it? Can you loan me 500 numbers? No, that should not be done. You cannot loan or sell it to any other institution. You can do it only with the permission of the state drug controller. So whenever, if you think, okay, this need to be provided to another institution, you have to write a letter to the state drug controller asking for this. If he permits, you can transfer this ENDs to another institution. Otherwise, it should not be done. And if suppose you have given the patient with 500 numbers of morphine, 10 milligram, and this patient died immediately after maybe after 2 days of this dispensing morphine. So this patient's caregiver might bring back these ENDs to your institution. Actually, you can get it from the caregiver, and then you have to enter it in your stock. Okay, this patient returned this much morphine. That can be entered as a stock. And morphine, the expiry, it is after 2 years. So you can keep it for 2 years. And if you have any unused essential narcotic drugs which has expired, then you should not dispose the essential narcotic drugs. You have to actually write to the state drug controller saying that, okay, we have this much amount of these much ENDs which has expired. And then either most probably the state drug controller will appoint somebody from his office to come to your institute, and they will dispose this medication in your presence. So we in the beginning we saw that when you apply for RMA status, you have to apply for you have to give what is the estimate of annual requirement that is given in the form number 3J. Okay, and this is this has to be done by before November 30th. And suppose you have given annual requirement of 1 kilogram, and you have purchased all the ENDs, and because the patient load was very high, and after some time there's no END with you. Can you again purchase END? Because it is not in the annual requirement, which you have already used. You can actually purchase END from the dealer. The only thing is that you have to give an explanation, or annual. You have to actually submit the revised annual estimate before the before August 31st. Okay. And I talked about various forms. So just to refresh your memories, the form number 3B is the special authorization for RMPs to keep ENDs, more quantity of ENDs in an individual capacity. Form number 3C is the consignment note. Form number 3D is the form in which if you are um, keeping the ENDs on an individual capacity, then there is form number 3D in which you have to give the, or you have to account the details. Which patient, what is the register number, how much ENDs you have dispensed, what is the daily closing stock. All those has to be done in the form number 3D. And form number 3E is the form in which you have to get the patient signature when you um, dispense ENDs. Form number 3F is the form in which you have to apply for RMA status, or if you, after 3 years, if you want to renew your RMA status, that has to be done in 3F. 3G is the format in which the RMI status is given from the drug controller. And form number 3H, if you are a recognized medical institution, then daily accounts of opioid dispensing should be done in form number 3H. 3I is the form in which annual return has to be filed to the drug controller before 31st March. And form number 3J is the annual estimate. Form number 3J is the annual estimate which has to be submitted. Okay. Thank you. I think these are a few things which you should know if you are planning to apply for recognized medical institution status. And now I think Lalit will be presenting more about the opioid and what is the status in India and other countries. And yeah, thank you. Lalit, I think you can.
Yes.
Yeah.
Good evening, everyone. Thank you, Dr. Sunil, for giving us a brief insight. I have my colleague John Surya who has joined from facilitation team. To give you a brief intro on what we do is, I think once you complete the training program with us, uh, we help you in assisting you with initiating these new palliative care centers and helping out with these processes. And one of those processes being the uh, getting of procurement of recognized medical institute certificate. Yeah, John, let's start this slideshow. So briefly, as I said, we help you out with this process. So we work throughout India. We are headquartered in Thiruvananthapuram, but a facilitator like me and John are placed across India. The rest of the teammates are in different parts of India who help out other organizations in procurement of these licenses. Next slide. So, so what we'll be doing is, just in case post completing this session, do download this PDF that we will be posting on our chat box. It's the NDPS rules that was brought in 2014, which gives you a detailed insight on the major changes that were brought in the NDPS amendments post 2014. I think a lot in medical fraternity too are not very much aware about these amendments. So going through that would give you a really good insight. We will take you through the major difficulties or the myths around this process that we have learned over the years, and what you should avoid, and what are the certain documentations that are not needed. John, next slide. So, as Sir said, and the Drug Control Administration in many states, it comes under the Food and Drug Administration. So, uh, along with these existing documents that Dr. Sunil mentioned would be required, there are certain additional documents. Sometimes the Drug Administration uh, insist on asking from the organizations which are not necessary. That is the reason that NDPS amendments were brought in, so that major blockers like this are not in the way. For example, if any of the drug administrator asks on affidavits from the trustees or the directors or a floor plan or the constitution of the institute, none of these documents are mandatory to produce, and it's not necessary. It's not under the rules that is required to produce. So it's entirely not required. Do remember this, because I would say sometimes the drug administration are also, I would say, quite not very much aware about it. So discussing on this rules with them usually enhances, I would say, the knowledge transfer practice between two stakeholders. John, next slide. So, just to recollect on the documents that the RMI Institute requires are a covering letter from the organization, Form 3F, and you might have seen the sample form in the previous presentation. The Form 3F gives a basic intro on the palliative care center. For example, the name of the head who would be leading the palliative care services, number of people involved, and the organization address, and so on. Then, with the completed Form 3J, it's the annual requirement for essential narcotic drugs. Then, fourth is it has three certificates that needs to go along with the documents. That is the medical graduation certificate of the doctor, the certificate of registration, and third would be the certification of training in, pain and palliative care. So these are the six major documents that we would require to submit to the drug administration of the required respective state. So we usually, once we fill out this application, we email as well as send a hard copy post to them. Then, as Dr. Sunil mentioned, with the drug inspector who would come for the drug inspection and check this various documents and the necessary requirements that are used to initiate palliative care services in that organization. John, next slide. So there are so another myth around with, I would say, barrier around this RMI institutes is the injectable needs separate license. Even that is wrong. All the formulations comes under RMI, and we can procure it under it. Because just to give you example, in few southern states, I would say Karnataka specifically, there is a rule that oral morphines and patches can be procured under RMI, but for injectables, they need to get a different certificate, a license. So that is where I would say the change in rules, the organizations face quite a few blockers in maintaining this record. So just to reiterate, injectables doesn't need a separate license. All of these are covered under RMI. Next slide. Yeah, so this is the notification of Department of Revenue where all the different formulas, all the different salts of morphine are eligible under RMI. So do give it a read. We will highlight the essential necessary document, I would say pages in this documentation for your references. Next slide, John. Again, so uh, now, there are existing practices that each, I would say, state has. So I think initially when I think in our the following session, I would say quite a few doctors, I mean, oncologists are there who prescribe opioids, and even anesthesiologists do because they believe they are trained in pain management. But I think as per the rules, I would say the individuals who are trained in pain and palliative care are legally, I would say, as per the rules, they are entitled to prescribe opioids. And this is one of those myths around medical fraternity where we are working with respective authorities to ensure this. But again, these are certain old practices which takes time to, I would say, unlearn and then adapt themselves to the new practice. So hopefully, everyone in the participation remember this. Next slide, John. And so just to reiterate, why do we mention this is because as per the rules in Chapter 5B, which you will be going through, it clearly states that a physician who is prescribing ENDs, essential narcotic drugs, they need to be trained in pain and palliative care. And then only they are eligible to apply, I would say, for recognized medical institute and prescribe essential narcotic drugs. So do remember we'll be sharing this PPT along with that document. So do reference it, do go through the chapter in a detailed manner because that would give you more of an insight on the rules that are there. Um, Next slide, John. So once again, many of the organizations are quite reluctant to apply for RMI because because I would say there is a sort of many blockers and myths around this. One would be the fear of punishment because essential narcotic drugs are something that needs to be maintained in a structured manner, and in and out should be properly there and should be properly monitored and evaluated so that there is no misuse. So, and that is something that usually, once doctors hear about this, they take a back seat. Then I would say the fear of I mean, going through the administrative processes, because in some states, luckily in Kerala, I think the drug administration is doing a wonderful job where they have implemented the NDPS rules and they are providing RMI accordingly. But that's not the case in every other states because a few of the doctors have to reach out to the administration where the rules are entirely different. Due to that process, people leave the RMI process. Then I would say again the reluctancy in maintaining documentation because you need a robust team where it's a collaborative exercise and you need to maintain an elaborate documentation of each and every END. And the fourth would be the reluctant to change because I would say quite a few organizations follow the old NDPS rules, which comes under the quota system. But I think they have their own challenges and blockers. So, yes, adapting to a new practice might take some time, but when the new practice is effective and it has next to no barriers, I think that is something that should be looked forward to, and we should try to bring that change to our respective organizations. Next slide, John. These are NCG guidelines where we showed it gives you a brief insight on through the rules into a simplified manner. We'll be sharing this document too. Hopefully you go through this and it gives you a detailed insight yet in a brief manner of all the guidelines along with the forms. So you can digitally edit the forms or you can download the forms and fill it out from your own end. Yeah, next slide, John. Um, just to give you a brief idea, where we have worked with various organizations across India in implementing providing opioid access. So uh, I would say we have worked with 31 state and rest, I think 3 states we are yet there to issue first RMI, and with 2 union territories, that would be Daman and Diu and Andaman. We have not yet collaborated there, but we have worked across India, I would say, um, across India, and the 31 states. I mean, by that we mean 26 states and few union territories, including Pondicherry. Um, Next slide, John. And along with that, just to raise awareness for medical fraternity, along with the drug administration, we collaborate with the drug administration of respective states, where we conduct opioid availability workshop, where it's a collaborative platform where doctors, the drug administrations, as in the director general, the drug inspectors, all are part of this workshop, where we sort of have a discussion on the new rules that were brought in and the old rules that are being followed, and how do we reduce that gap, and how do we bring in the new changes, because as I mentioned earlier, there are other states where old NDPS rules are being followed. So we actively try to collaborate, and I think there are few other states where where our work is still in progress, and the states that are in yellow are the states where we are still in progress to get a crack with the drug administration. Hopefully, we are successful in achieving that. And any sort of help in this manner would be really helpful from the participants. Next slide, John. Um, yeah, I think additionally from our end, I would say Walk with the Very is one of those books where it gives you a brief insight into our chairman, I would say Dr. Rajagopal, who has given a brief insight on his journey in palliative care and how I would say that led to Pallium India's creation. It plays a crucial role in Pallium India's creation, and we are here right now. So I would say give it a read, and it's available on Amazon. And the foreword is written by Sashi Tharoor. So I hope everyone would like it. That's it. Thank you. John, you can end the presentation. Um, so I would say this is the brief process. John, do post our contact details in the chat box.
Yeah.
So once you go back to once you get back to your regular services, and when you need any assistance with, I would say, palliative care centers, be it procurement of RMI, from helping you out with filling out these forms. And then once the form is submitted to the drug administration, the follow-ups with the drug administration and the status of the application is something that we help out with. So all you need to do is, once you feel like you have the mentioned infrastructure to procure RMI, you can reach out to us to the given contact details. We'll be there throughout. John would be the primary contact person in Kerala. He's well versed with Malayalam, and that's so you can reach out to him or me. We will help you out with the application. Then once the application is submitted, we'll follow up with the drug administration and keep you posted on the regular updates. And hopefully, once that is done, we successfully close on getting this RMI. Apart from that, any assistance in setting up a new center, um, we would be happy to assist in any way possible. So we'd be looking forward to hear from you. I'm open to questions if you have any questions or anything to share.
So just I think we had shared a questionnaire with Google Form with the participants, and we have covered almost all the questions, but I think there were one question on whether the um, dental colleges can get RMI status, or uh, should they go to the
Sir,
corresponding
do you
medical
want me to
college? And
project the question, sir?
no.
Okay, sir.
So actually, if you are a dental graduate, and if you have training in pain relief and palliative care, and if you are working in a dental college, then and your head of the institution can apply for RMI status, and you can have an RMI, and the person who has taken the training, he would be the registered medical practitioner. And the only thing is that your um, practice according to the Indian Dental Council Act, you should practice the pain relief and palliative care that is restricted to the oral and maxillofacial region. Otherwise, you can prescribe the essential narcotic drugs if you are a person who got training in pain relief and palliative care.
Just one query, because some people, is this what you projected today about this NDPS and things for dentists? Even now you said if it is oral, max, what happens? See, because in palliative care, it may not be restricted like that, no? So what happens in different states? Is this accepted all over India? That any
Uh,
dentist can practice palliative care even though they have done only BDS or MDS. So just because some people do ask me, so I thought just in
so
case for
and
everyone else.
yeah, so the NDPS Act is uniform across India. Previously, every state they had some powers to modify according to their like. But because of this problem, opioids were or ENTs were not available to many of the patients. It was very difficult to get. So the center now has taken a decision that the NDPS laws would be the same across all the states. And all those things applicable to a person with MBBS is also applicable to various doctor. But the only thing which I told you is their area of practice is should be restricted to oral and maxillofacial areas.
If anybody else has any other
Any
question, you can ask, because as Dr. Sunil said, I also went through all the questions and nearly most of your queries would have been answered by Dr. Sunil's session and Lalit's session together, because mostly somewhere injection, can I buy in this, that. So nearly everything has been covered. So if someone feels they've asked some question and that has not been clarified, please unmute and ask. Because from what we have seen, we feel that everything has been covered. So that doesn't mean you should not ask.
Just
Please
for
go ahead.
learning, ma'am, fentanyl patches you described, do we use fentanyl in injection form?
Sorry, I didn't get you, Dr. Nirupa.
You discussed about fentanyl patches. How commonly is fentanyl injection available? I just wanted to know about the availability and use.
Okay, so under RMI status, you can get any forms of essential narcotic drugs. So fentanyl, it is if you have RMI, you can purchase all the forms of fentanyl. It might be patches, it might be injection, it might be lollipops, which is called as oral transmucosal fentanyl citrate, which is used for incident pain. Okay, so there is no restriction which form you can purchase, and it is easily available. Fentanyl patch is easily available. Injection is also easily available. So the only thing which we do not have in India is hydrocodone and oxycodone. But otherwise, the other four medications or essential narcotic drugs are easily available. But codeine is not used nowadays by most of the people in palliative care community, because it has many side effects.
See, in all these things, no, availability is one thing, and comfort and confidence in using it. How confident and comfortable you are. If you have used it before, well and good. If you have not used it, so those are all personal. So that's why we say hands-on, hands-on. Hands-on is very, very important to get the confidence and things. See, this training or something plus hands-on is what will give you the comfort and confidence to use any of these.
So just want to tell you that last year we used more than 5 kilograms of ENDs in our institution. That includes mostly it would be morphine. 90% of that would be morphine, then fentanyl injections, methadone. So yeah.
I have a query. Can I ask?
Yes.
Yeah, suppose I need to start a outpatient clinic for palliative care. I'm a surgical oncologist. I have a practice of say around 10 to 15 cancer patients, new patients per month.
Yeah.
Now, how do I give this projection of estimated requirement for 1 year?
Sir, actually, you need not go into such calculations. You just apply for 500 grams annual estimate. And if you need more than that, revised annual estimate can be submitted. I don't think you will need 500 grams. There are some
Yeah,
complicated
that's it.
calculation. Yeah, but I don't think that is not necessary.
So
Okay.
just
As
you
you
mentioned,
finish, you can keep on getting. So that is what he's saying. No, so you get, and then depending on your load you use, and if you finish it and you need more, you can apply. That's it, isn't it, Dr. Sunil? So that need not restrict them.
Yeah.
That's what. So that is the thing to take. Somebody else wanted to ask something, please.
you said it was difficult to get oxycodone. So I'm just coming back to the oxycodone. Um, uh, is there any particular reason why there is, or
No, oxycodone and hydrocodone are not manufactured in India. That's the reason.
because for patients with renal failure, usually it's good to, I mean, I was wondering, so we move them from morphine to fentanyl, and usually oxycodone is used in between. So, is there any reason why it's not being done, or is it
No, it is not manufactured. That's all.
Not
It is not
available. That's what he
manufactured.
said.
It
Yeah,
is
so
not
I don't know. I was
manufactured
just
in India.
wondering why the government has allowed other opioids, but not oxycodone. Was there any particular reason? I was just thinking like that.
No, it was not available, but as it is an END, government says it would be available in the future.
Thank you.
And methadone is also a good medication to be used in patients with chronic renal failure. Fentanyl, it would be very difficult to titrate because it is available only for most of the patients. You have to give a patch, and from the patch only specific amount of medication is released. If you are applying 12.5 microgram patch, that means only 12.5 microgram would be released into the bloodstream. So it is not a good drug for titration, and it is also very costly. So if you give it for a poor patient, then that's going to be a problem. They would not use it, and they will come again to you and will tell you that I do not have pain relief. So I see there is a question in the chat. I'm working in a hospital in rural Odisha. After I complete this training, will I be certified as RMP? Yeah. So once you complete this training, and you will get the certificate, and that will be a proof that you have experience with essential narcotic drugs or training in pain relief and palliative care. I think now.
Can we go on to the poll?
Yeah, please.
Sangeet,
So,
Sangeet, maybe
So now
because
we
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 have
have a
15 time.
few questions which Sangeet will be putting it as a poll, and just for you to understand what has been talked to you in the last 1 hour. Uh, just want to understand whatever you have digested. Uh, so
Okay.
Sangeet will be showing this poll. You will
Oh.
be seeing it in two sittings, isn't it?
Eh,
10
sir,
questions first.
no, sir. There are three polls.
Okay.
Five
5 questions
questions
each.
of each, sir.
Okay.
Okay. So participants, there are three polls which consist of 5 questions each, and each poll has 2.5 minutes for doing that. Okay. Please make sure that you will do each poll before 2.5 minutes.
And once you complete the 5 questions, please click submit. Sangeet, please share. Yeah. I hope all of you can see this poll. So just select the answer for these 5 questions, and once you complete it, submit.
I'm not seeing any questions.
Sangeet, are you using a mobile phone or laptop?
Mobile.
I think there would be 3 dots either on the right hand side or left hand side in the top side. And if you click
Okay.
on that, I think it should come. Only 11 of you have completed these questions now. We have 58, at least 50 participants here. Request all of you to do, please. Yeah. So first, poll 1 should be, you would see the poll 1 only. And after some time, Sangeet will be sharing the poll 2 and poll 3.
Also is telling Beena Kumari also has mentioned that she cannot see the poll, I think.
So please see the 3 dots on your phone in the upper right one. So you might have to change the window. That might be another problem.
Yes, sir.
Three of you have completed.
So can I share the results?
Yeah. Okay, the first question was, which of the following is not an essential narcotic drug? Most of you got it right. So we already said that there are 6 essential narcotic drugs: morphine, methadone, fentanyl, codeine. So in this question, buprenorphine is the one which is not the essential narcotic drug. What is an RMI? RMI is a recognized medical institution. It is not a registered medical institution. It is recognized medical institution. The authorization for RMI is for a period of 3 years. Yeah. Who can be the officer in charge of RMI? Any person any person registered as a medical practitioner under Indian Medical Council Act and undergone training in medical use of ENTs. So both of this should be there. Which of the following is a prerequisite for an RMI? Safe locking cupboard, officer in charge of the RMI, trained in medical use of ENT, basic infrastructure and facilities, one person for mandated record keeping. All of the above. Yeah, it's all of the above. Sangeet, can you
Why,
share the
Sangeet?
second one?
Share the second one, and why many are telling can't see, can't see? Like tell them other options or something, Sangeet, if
So
they want.
I think they might be in different windows on the phone. So they have
Okay.
to keep changing the windows and see where is the spot.
Okay. In that case, all of you, please try.
Okay, so can we release the second poll?
Yes,
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 please go
please.
ahead. Please.
So if you see that if you are on the laptop, you can see there is a small gray bar on the right hand side of the poll, which you have to keep moving. Then only you will see all the questions. If you are on a laptop, keep the cursor on the poll and just move the mouse. That's all. Then you will be able to see all the questions. Thirteen of you have completed. Please do it fast. Twenty-four of you have completed now. 26, 29, 30, 31, 32. Okay, Sangeeta, can we end the poll?
Okay, sir.
Okay, the first question was, when should an RMI submit an annual return form? It is before the 31st March of every year. The expired stock of ENDs can be destroyed by the officer in charge of RMI. No, it should not be done. You have to write to the state drug controller and he will appoint or he will designate probably a drug inspector to come to your institution and they will destroy the expired stock in your presence. Which of the following form is to be filled to apply as an RMI? It is form number 3F. Within how many days does the drug controller reply to your application? It is 60 days. Okay. So if he think, okay, RMI can be given or it if he denied to give, whatever it may be, the answer should be given within 60 days. Which of the following narcotic form has the patient signature to whom END were dispensed? That is form number 3E. Okay. So, Sangeet, can you
Okay,
come
sir.
up with the third code?
Okay, sir.
Okay, now all of you please do this third code. When do you have completed? Thirty-nine has completed now. 40. Okay, Sangeet, please close the code. Okay, the first one is I can prescribe oral morphine if I am a super specialty doctor without any training in pain relief and palliative care. So that is false. So according to the NDPS Act, the registered medical practitioner means either a person with MBBS who has registered with State Medical Council or a person with VDS who has registration with the State Dental Council. And they should also have training in pain relief or pain relief and palliative care or training in oral substitution therapy. So that person is called as RMP, registered medical practitioner. Only those person can prescribe any ENDs as per NDPS Act. All record of ENDs, next question is all record of ENDs dispensed with day-to-day account of each transaction in ENDs are kept in the period of dash from the date of last entry. So I told you that we have to keep these records for 2 years. 3 years is the duration for which RMI is provided. Recognized medical institution status is for 3 years, but this is about the record keeping. How long we need to keep a record from the date of last entry? It is 2 years. If the requirement for ENT has increased during the course of the year, the officer in charge of RMI can submit the revised estimate for the same year by, what is the answer? Revised annual estimate, when should it be completed? Before August 30th. Any individual registered medical practitioner may hold a small stock of ENT. So here it is registered medical practitioner. We already defined who is a registered medical practitioner. So it is a small amount of ENT they can hold. That is true. But there is restriction. How much amount of morphine you can hold, how much fentanyl, how much codeine, etc. When should an RMI, next question is, when should an RMI submit the annual estimate? Every year. 30th November, 30th March, 30th August, anytime. It is 30th November. Okay. I think I made one mistake. If the requirement of END has increased during the course of the year, the officer in charge of RMI can submit the revised estimate for the same year by 31st August. That's the right choice. Okay, you can end the poll. Close the poll, Sangeet. Okay, so I think you might be confused with the different forms and different dates, but I think it is important for us to understand at least, okay, there are some forms which we need to keep with if you have RMI. And there are some timelines by which we have to file the annual return, annual estimate. So if you understand this much, I think that would be more than enough, because the rest you can see the documents and submit it appropriately.
And our
So,
team will help you. So that
yeah.
is the thing, no? Like Pallium does hand holding. Today you have seen Lalit, John, they're all there to help you. You're not left in the dark. Okay, don't think, oh, 3F, 3BC, 3D, oh, everything is there. It's not like that. As Dr. Sunil said, you just be aware. So because you should know, if someone comes and tells you where you have to give 3F, they say 3D, at least you should know that what you have to give. So first, for all of you to gain clarity and confidence, that is what this session will help. And to actually do it, Lalit will help. That's why we have got the whole team here, because this is one of the things why everyone, see, end of the day, even WHO says they've got morphine now everywhere, all over the world. But morphine is not reaching the patient per se. So how can we get it to the patient? See, all of you are seeing every day we see who like stage 3 or stage 4 who are in agony where morphine only will help and ease the pain, and then they can at least sit, do something for themselves till their last day. Why should they not get it? For that only this is all done, and the whole team will help you. If you're ready to do it, then come and get in touch with Pallium, and Pallium will take you through step by step. Okay, anybody wants to ask anything? Or have we loaded you with everything? So too much for today. Anybody just wants to unmute and say, this is one of the important sessions. So do you want to unmute and say what you felt or how you felt with this session? Because we also try to do these things in such a way it is helpful for you. So anybody wants to unmute and speak something, please do that before we close.
I think it was very useful. Thank you, because it's very practical explanation of how we deal with morphine and opioids, which is unique to our country. So I think it's very practical and useful. And thank you for offering to help with all the forms and all those details. It's not easy to read the forms and understand. So thank you very much for that explanation. Very
Thank
sincere
you.
and good thanks.
Thank you very much, Nirupa. That's the main aim of Pallium, is to help everyone so that the job is made easy. Everything is fear of the unknown, okay? But when you know everything, oh, is this what it is? Then I'm okay to do it. I didn't know that it is how it needed to be done. That's the way forward, okay? Thank you
But
very
very
much.
few people offer to help so much, but Pallium helps everybody. So thank you very much.
That's why I keep telling, we will handhold, we will come, we will. God's grace, no, we are able to do it. And first is the willingness, okay? That willingness to go a little bit forward or stretch your hand, something like that. Okay, thank you, Lalit. Thank you, John. It's the entire team. As a team we work together. So see, we can say then John and Lalit are the people, like, not they have shared the contact number of the whole of India team. Okay, the whole facilitation team details are shared in the chat box. I did see everything was there. Yes. Okay. So because someone asked Odisha, yes, we have Sunanda there. Everywhere we have people, and each and every one in that team are excellent. Okay. So no way. Like each one will excel the other. Like see Sunanda, Toronto, everyone. You've got you've got everyone there, isn't it? Have you missed anyone? Ron to Rajendra, Jatin, again, he's a doctor who is also there. Everyone, like all of them are very helpful. So whoever is there from whichever area, please take note of the corresponding facilitator whom you need to contact. Yeah, again, we'll share this in one more session when we will be taking you through organizing palliative care. So in that also, we'll share all their details, and then Sangeet can share it in the WhatsApp group also. We'll do that when we do that session also. Okay. Thank you once again to everyone. Over to you, Sangeet. Thank you. A big thank you to Dr. Sunil. Okay. I can't take him for granted. Okay. I have to be true to what he does. He puts his heart and soul to it. Okay. So big thank you to Dr. Sunil also.
Thank you. Thank you. Thank you, Dr. Sunil, for the wonderful and informative sessions. Thank you, Lalit and John, for the session also. Thank you, Radha ma'am, for facilitating the sessions. I want to inform you that we have a post end evaluation on we will be releasing on the WhatsApp group. Please do so that we can understand what you have obtained from this session onwards. It will be releasing in the WhatsApp group. Please do it as well. Thank you. Thank you all. Let's see you in the next session.